Welcome to the last panel of the day. Phew, what an adventure. We are joined today by 700 live stream participants, so we're not alone. So welcome. With the growing availability of health data and AI applications, Singapore's healthcare is evolving. The adoption of AI technology also holds the promise of reduced manpower requirements, time and cost, as well as other exciting opportunities. At the same time, as stewards of this technology, we too are called to be accountable with regard to ethical care and questions pertaining to the use of AI in the healthcare and medical arena. We are grateful to have with us today experts from the field to discuss the development of AI in Singapore's healthcare and how we can be better prepared for an AI future. Without further ado, I would like to welcome the panelists for today. Assistant Professor Feng Mengling, Dr. Pauline Erica Tay, and the moderator for today's panel, Dr. Ngiam Yuan. Dr. Ngiam, in your capable hands, please.
Thank you very much. Thank you for this opportunity for us to be able to share some insights we have about AI and AI in the industry. So my name is Dr. Ngiam. I'm from the National University Health System, and I'm also concurrently the head of the Department of Biomedical Informatics here at NUS. So with me today, my esteemed panelists and good friends, right? I'm going to ask them to introduce themselves in a minute, but today you guys are in for a treat, right? Because these are the experts, right, in the field of AI, both in industry as well as in academia. And I look forward to very exciting discussions, and hopefully we'll learn something really, really cool about what's happening in the space of AI. So Pauline, if you can introduce yourself.
Thank you, Prof. Ngiam. You're totally modest because he's the real AI expert here in health.
I'm moderator.
So I'm Pauline. I'm director at the National Health Innovation Center. So this is a government-linked entity, and we support all the public healthcare institutions in Singapore to innovate, develop, commercialize, and adopt new technologies into clinical practice. So certainly a lot of opportunities for industry as well to participate in some of these innovation projects in collaboration with our public healthcare clusters. And then of course, one of the sort of product of these collaborations is Mengling, who will tell you more about himself.
Hi, Hi, everyone. As mentioned, my Chinese name is Mengling. And occasionally people would just call me Mengling. So I ask... Yes, so I asked them to call me Morning, is that so to avoid confusion. So just call me Morning. I wear a couple of hats on the daytime, my full-time job. My bosses are sitting down there as well. I'm a faculty in Social Hawk School of Public Health in NUS, and also the Assistant Director of Research in the Institute of Data Science in NUS. So I'm leading a healthcare AI lab, develop a lot of healthcare AI solutions, working with physicians and etc. And also very proudly, one of our early projects with my first PhD students managed to, from research, lead to a spin-off from NUS. And with strong support from Pauline and his team, they managed to commercialize the product and form a company called FathomX. So on night time, after I off from work, then I'm also the chief scientist for FathomX. Nice meeting all of you.
So before we begin, you may also wish to scan the QR code for our Poll Everywhere platform so you can put in your questions as the panelists are answering the discussion.
All right, everyone got that? I'm looking forward to your questions because I'm monitoring you, right, with a poll everywhere. Okay, so without further ado, I'm just going to sell a bit of Goyok first, okay? So just give me 2 minutes to sell Goyok. So earlier I mentioned that I lead up a Department of Biomedical Informatics. So this is a department within the School of Medicine that teaches AI in healthcare practitioners and also non-healthcare practitioners, right? So we've been running our master's degree for the last few years, and I thought I'd show this slide because it sets the pretext for some of the things that we'll be talking about this afternoon. So if you think about what we are doing today in our jobs in any industry, not just healthcare, right? And you think about the repetitive manual things that you do, right? Whether it's writing a report, writing a white paper, familiar, right? Writing a white paper, writing minutes of meetings. Today, if you're not using GPT-based way to do it, right? You got to look above you because you will see a rock, right? Because you're living under a rock. Everybody else is doing it, right? You always wonder, hey, how is it that the minutes are generated within 5 minutes of the meeting? It's because it's generated by AI, right? So nobody generates minutes anymore. It's made by the language model. And what we really want to do is to teach how people, human beings, how to use these tools, right, effectively in their day-to-day job. So you see some of the areas that I'm pointing out here behind me. We teach a core structure that allows people to understand how to use and interpret AI. We also allow them to take various modules, which I'll show in a minute, and also how you can specialize in those modules. So in healthcare, whether you want to be a data scientist or you want to be a hospital administrator, we offer modules for you to do that. And of course, these are all coupled with hands-on internships. I think there's nothing better than practice. If you can take your knowledge and practice it, that is the best way to learn something. So this particular Masters of Science in Biomedical Informatics gives us the learners the ability to learn all of these things that you see here. So everything from advanced biomedical informatics to bioinformatics, which is using genomic and omics kind of data and how to process them, all the way through to skills that are required to do computing projects, such as agile project management, as well as things like leadership, right? So we teach across the board, across classes, cross-disciplinary courses, and we hope that when our students graduate, we have graduated 2 batches already, they are highly sought after in industry, okay? And hand to heart, I can tell you, all my students are employed, so that's good, okay? Right, so I'm not going to hop on this further, and I really want to hand the time over to Pauline to tell us more about NHIC. Yep, there you go.
Thanks, Prof. Ngiam. Okay, I'm going to stand because I speak better that way.
Okay, sure.
I'm automatically louder. All right, I am actually very, very grateful, deeply honored to be back in my alma mater. I was a student here many decades ago. I wouldn't say many years ago, many decades ago in NUS at the medical faculty, actually. In those days, when you chose to do biochemistry, microbiology, and physiology, it was not in the School of Biological Sciences or Science. It was in the Department of Medicine. So it was a real privilege to share some of the modules with clinicians like probably Prof. Ngiam and his peers, and to understand why we did what we did, why we believed in what we did in terms of understanding science, because it augments better patient care, better health, better lives for people. So I was always constantly driven by that kind of the passion to be able to contribute to betterment of people's lives. And it was super interesting that in the last couple of years, a new technology called AI came onto the scene. And before you know it, AI is now coming into healthcare. So as I said, I'm part of the National Health Innovation Center, NHIC for short, and we hope and aim to drive impactful health and economic outcomes through the programs that we provide to the support of the clinical community in partnership with industry. All right, so actually we are a government-linked entity under the Ministry of Health Holdings. So although we're a company limited by guarantee, we hope that with this structure, we are as agile as private sectors and hopefully some of the startups around the ecosystem, but that we also have governance and links to government funding that might be necessary to push some of these frontier science ahead in healthcare. We are part of a larger consortium called the Consortium for Clinical Research and Innovation, or CRIS for short, where we have about 6 business units that was set up for the purpose of translating clinical research and innovation into impact, right? So all the R&D that people have been doing over the last couple of years, whether it's in healthcare or AI, we hope to be able to translate that into real impact through innovation and commercialization. So I won't go through all the different business units. You can see they do focus on certain areas, verticals, as well as horizontals like ourselves, NHIC for innovation and commercialization, and even clinical trials undertaken by our sister business unit, SCRI. All right. Just so that for some of you, I mean, if you're in a healthcare system, no surprises, but even if you're a Singaporean or a resident here, you might not know that Singapore, being such a small nation, is still divided into 3 geographical regions served by 3 different public healthcare clusters. So on the western side of the house, you have the NUHS, where we are today, served by, this is the western region served by NUHS, and in fact, that's where Prof. Ngiam comes from, and Morning from NUS that works with NUHS to give rise to very, very innovative solutions like FathomX. Somewhere in the middle, the central and the north, is served by the National Healthcare Group. Somewhere in the east and the southern part is served by Sing Health. All right, so I guess many of you have heard in terms of population health and healthcare SG, we might be moving to a situation where you will go to your respective clusters, and that's one GP or one hospital would serve you throughout your lives, although that will take some time to implement. All right, hang on, how do I go back? Okay. So how do we support innovation in healthcare? So innovation is a very, very long journey and a continuum. I'm pleased to say that NHIC can support the entire journey, right from ideation, through development, through commercialization, and finally being able to adopt these new technologies for long-term purpose and change into clinical practice. So say, for example, if you're working with an early clinician, or if you're an early clinician yourself and you have knowledge of an unmet clinical need, you can come to us, and we can probably give you a small amount of $100,000 to convert that clinical need into something that you can build, like a product or service. Thereafter, you can also come back a couple of times, right, for other grants that help with developing that into a more market-ready solution, and definitely last but not least, to have it adopted across the Singapore healthcare clusters. I saw my 1 minute mark, so I'm just going to go through very quickly. Besides funding, we also support these innovation teams in terms of bringing consultants for regulatory, business planning, and even market access and talent development. All right. Now, this is an AI workshop and AI in healthcare symposium, so you must be wondering, what's our role, right? In fact, our role is to support a lot of new innovations, because you have your Chat GPT and XYZ GPT saying they can do these things all in healthcare. But it is training the algorithm so that it performs and supports the work of the clinical practitioners that makes it useful. It's not about how great that algorithm or that GPT is. It's whether or not it provides the right diagnosis to plan for the right treatment. So NHIC in its last 10 years actually did support a lot of these AI projects which have finally gone to market, one of which is actually FathomX, that will, Morning will tell you a little bit more about it. So it ranges from scanning radiological images to scanning of the eye, to being able to do accurate spinal cord injections, and of course managing chronic care, like assessing triaging in the emergency department. So without further ado, I'm just going to hand over to Morning to tell you more about FathomX.
Thank you, Pauline. Just to remember something, she's the boss lady, right? Any one of you who want to do innovations, she's the lady. Anyway.
No, experts.
Okay, anyway, over to Morning.
Yes, and I will, with example to show you why Pauline is the boss. Okay, again, as mentioned, I'm a faculty now in NUS. My background is as a computer scientist. I did my PhD in actually school computing, focusing on AI. So unfortunately, I'm those type of doctor that can't save people's life. Very honored to sit with 2 of the actual doctors here. And I lead a healthcare AI lab with about 20 researchers now. They're also mainly engineering and com science background. And I organized my labs focusing on 3 themes. The first one kind of lead to our spin-off called FathomX that Pauline mentioned just now, focusing on computer vision. That's probably the oldest team in my lab. FathomX is a project from that team, a flagship project. Basically, my first PhD students, with a couple of postdocs later on, they developed an AI solution that can read digital mammograms and diagnose breast cancer, aiming to enhance our breast cancer screening program. We were very lucky that in 2019, we received a grant from MNRC to kind of conduct the research in Singapore and localize or customize our AI solution for our Asian population. After we've done the research, while we are thinking to translate our research products to commercialization to actually clinically deployable product, we were a bit lost, and again, very luckily, we met Pauline and NHIC colleagues that not only provide us, very importantly, the money, and also their guidance as well. They help us to bring an AI product to actually usable, deployable clinical product. Because one thing to learn is my postdocs and PhD, they are very good AI scientists, but the user interface and the product they develop are horrible things. So we actually need the fundings to hire a professional software engineering team to actually bring a research idea and research outcome to actual product. And also now, recently, very glad again, we received a new program from NHIC called Innovation to Adopt that support us again to scale up our products across 3 healthcare clusters in Singapore. So that's the computer vision story. And then the second one, the up-and-coming team within our lab, there are a bunch of folks working on reinforcement learning for treatment recommendations. For those who are new to reinforcement learning, I have 3 kids myself. So it's pretty much like educating your kids. If they do some good behavior, so you give rewards, give a candy. If they did something not so desirable, right, as a Chinese parent, so we will, yeah, you know what I mean? Yeah, don't report me. So yeah, we show our love. Yeah, we show our tough love, right? So as a father. Then over time, right? The AI over time is a dynamic learning process, right? Over time, like our kids, then they learn what are the proper behaviors. And this concept is being very commonly used in gaming, like the famous AlphaGo algorithm, to help them to achieve and optimize the long-term and short-term goal. And we do see the similarity there in medicine as well. And therefore, we have been implementing and developing a lot of these reinforcement learning algorithms for medicine as well. And we have seen some successful cases in using RL for managing critical care patients and also chronic conditions. And last project is something related to a language model. In this case, interestingly, it's actually a small language model, and I'll tell you why. And this project, we are in collaboration with actually SCDF, the 995 call center. The challenge in call center, what they face is that their call takers is actually a very stressful job, right? They're very good people because by requirement, every call goes to 995. They will have to triage the urgency of the patient within 1 minute, ideally, at most 2 minutes, right? They triage P1 means most severe, P4 means non-urgency, no ambulance needed. They have to sort of triage patient from P1 to P4 within 2 minutes time. As I mentioned, it's a very stressful job, and they only can judge based on conversation. So together, working with SDF, we developed an AI assistant to help them to call takers to automatically capture a lot of these informations, automatically fill in the forms, and also help them to predict the triage as well. And for my last minute, I have a showcase here to showcase how the AI is working. The AI is going to listen to the call automatically, convert it to text, and then understanding and fill up the forms and make the triage later on. And due to privacy, it is simulated with my voice, so no actual human being was harmed in this video. Okay.
Hello, this is 995 Emergency Call Center. How may I assist you?
Hi, I need help. I just got into a car accident.
Forgive my acting.
May I know your current location?
I'm now at the corner of Yishun Avenue 4 and Yishun Road.
So you can see the AI is transcribing everything, and they pick up the address automatically.
No, I'm not bleeding, but I think I'm injured.
Which part of the body is injured?
I think my arms and legs are both injured.
Is anyone trapped in the car?
No one trapped in the car.
What vehicles are involved?
SUV, I'm driving an SUV.
Yeah, you can see on the left-hand side, the form is being populated while we chat.
No one flew from the car, but I'm injured. Help.
Yeah, and actually by this time, they already detected the triage level.
I'm alert. Please
and actually, in actual practice, this message will be shared with the dispatcher. The ambulance will be already on the way even before we finish the conversation.
Where the ambulance is rushing down.
Okay, thank you.
Yes. Okay. So yeah, I mean, I'll wrap it up with that. Again, forgive my poor acting.
Round of applause, come on. It's like Oscar level performance, isn't it? Okay, so So just to get this afternoon going and kick off this panel session, I have some of your questions here already, and I strongly encourage all of you to put your questions into the poll everywhere, and I'll be sure to read them out to you. Just to get the afternoon going, just a quick show of hands, right? How many of you have done or are using coding? You know how to code? How many people? 1, 2, Jim, of course, yes. 2 or 3, okay. How many of you have used ChatGPT or equivalent language models? Hands up. Okay, at least 10 times more. Okay, so I think this is a nice story, right? Let me explain why. This generation of AI wave, right? This is the second AI summer. The first one happened in 2013, 2014, and that's when I started working with Pauline here, where we were building the very first generation neural network models, right, and to be used in healthcare. It was really limited, right, to the people who knew how to code, right? If you don't know how to code, that's it. You're not part of that wave. This generation's AI wave is a completely different generation. Why? Because as you can see, right, in a quick show of hands, it's generally available to almost anyone, right? As long as you speak a language, right? You don't even have to speak English, right? That tool is available to you. So the point I'm trying to make here is that this AI wave is not limited to coders. It's not even limited to people who use language models. Every industry will be affected. Okay, every single industry will be affected. If you think that it doesn't involve you, then you are very, very wrong, because someone else will use it and will get ahead, right? And if it's not your job, then it's somebody else's job or another company or another country. So in that context, right, when I see the word FutureWork2.0, right, it's going to be a very different future, right, as we see it. So no longer are we going to be limited by people who can or cannot use technology, because everyone should be able to use technology, right? As long as you can use a chat or WhatsApp or any kind of messaging interface, you should be able to use this. And in that context, we must then think about how are we going to be prepared, or how do we train ourselves, right, to be able to use this technology well, right? And to do that, we really need some form of framework. It's not just, oh, okay, let's sit here and try to ask this thing a few questions and see whether we get something out of it. You can do that, but again, what are you trying to achieve there, right? And here I would strongly encourage everyone to ask questions and really pick the top brains that we have here today on how they want to use, how you can take this tool that we have today, right, available to everyone almost for free, and how can you make that into something of value, not just to yourself, and for those of you who are running companies or running institutions, how can that be of value to your institution? So in that context, I'm going to pose my first questions to my panelists, right? And perhaps starting with Pauline, right? So one of the questions here, right? So what do you think is the most exciting use case of this generation's AI, based on your experience of what's being developed out there?
I'd like to say healthcare, but that's so cliche because we all work in healthcare, right?
Yeah.
Actually, for me, I think it would be like in Iron Man, there's Jarvis. It's like your AI concierge or your AI PA, right? That's so cool because you can ask Jarvis to do almost everything, we think, right? Not just healthcare, but really even autonomous driving or, even self-defense. You just say, hey, Jarvis, or in my case, maybe, hey, Paracat, come save me, right? And it's not just a response on a chat bot, but that something will assemble and come and save me. And I think that's the promise of, if we manage AI well, this could be, like AI could be our personal assistant or concierge. Yeah.
Morning.
Okay, and along that line, also for healthcare, what I see is when AI can come in is, we live in an era when we are always overwhelmed with information, right? Related to healthcare as well, especially after pandemic, right? There's so much misinformation being spread out during the pandemic, and also so many updates about treatments, new guidelines, new drugs, new developments about pandemics, and also with other chronic disease and everything. So every day, so many things are happening, right? So I do feel for our physicians here that they have first they have to deal with so many information we are gathering about the patient. At the same time, they have to digest all these updates from the research fields and also from the pharma company. I hope that AI can come in here to serve both the physicians and the layman, right? That can effectively help us to summarize all this information and then also to help to fact check, filter out all the misinformation, and also help to prioritize, right, what are the key information that we need to digest, right, given our very limited attention that can last only 30 seconds for the TikTok video, right? So yeah, exactly. So how many tweets we can read every day? So help us to digest that. I do see, as an educator, also as a scientist, I do see that one way help us to more effectively digest knowledge. Yeah. In future.
Well, that's great. So morning, you help me create one of these, okay? Because that's what we need. And on that point, I think it's well worth to bring up. Why healthcare? I mean, you are sitting here in a talk about AI in healthcare. You know, healthcare traditionally has been the laggard, right? The slow adopter of technology because of its, you know, restrictions, regulations, and so on and so forth, and data protection. So with this generation of AI tools, that's no longer true. Okay. In fact, this morning I was having a meeting with a colleague in Microsoft, and they are telling me that healthcare is the #1 adopter of language models. #1. And why? Because a large amount of healthcare information is captured in text, right? For so many years, we've not been able to easily access this information because you just imagine you have to have, you know, hundreds of doctors read through all these notes and extract information. Similarly to reading, you know, medical literature, it just takes a lot of human eyeball time, right? But today that's trivial, right? You can just ask ChatGPT or equivalent GPTs, and they should be able to nicely summarize things for you and even generate specific things that you would like it to know. So for example, you can ask, what's the latest evidence on this? And you can, or give me synthesize the past and the present information with regard to this particular diagnosis or treatment area, and you will do so, right? So again, that's now trivial, and that suddenly unlocks a whole mountain worth of information previously stored in text. Okay, so this is why in healthcare today, AI is one of the most disruptive technologies in healthcare. And of course, in the last generation, when we look at AI in imaging, that what Morning has been researching on, that's now notched up another level, right? So, for example, beyond just doing mammography, for example, right? Now there are emerging tools that can not just read the mammogram, but generate the report. So that is a different level of skill because it requires interpretation. It's not just saying, okay, there's a lump here, right? So, Morning, any comments?
Yeah, absolutely. And okay, I need to choose my words very carefully. It's not that we want to replace our radiologists. AI is coming as an assistant, but just reporting the capabilities of AI agents nowadays. As Prof. Ngiam was saying, not just that it can look at the image, estimate the risk, binary yes or no, cancer and no, kind of simple things. Many tools across different diseases and organs, they are capable to highlight the suspected lesions, suggest what kind of lesion it is, and the chance of being malignant or benign. And at the same time, based on all these defined lesions, they will draft a report for the radiologists, right? And all this is without, actually, as an AI scientist, we really have no intention to replace our colleagues from radiologists, but rather as an assistive tool, right, that to help them to improve their productivity. Hopefully with these tools, rather they can, you know, diagnose 100 patients a day, hopefully they can now diagnose 300 or even more. And I do see the value that the human radiologists still be in the loop. Where AI, it's very, I would say, its performance is very reliable and effective for common and well-known cases. Okay, so those cases, I think I would confidently say as an AI scientist, right? 80% of the very common cases, I foresee that the radiologists just have to go through as if they read through their junior residents' work and just endorse it. However, for some niche cases, that's where their experience kicks in, their instinct kicks in, to deal with all those the long tail cases where in statistics or in AI that we didn't have enough data to train the AI for. So I do see a very nice complement between the two here.
So to add to that point, I'm speaking as a doctor now, right? As a clinician, I don't think doctors will be replaced. Okay, but let me tell you why we won't be replaced. Because you need somebody to blame, right? It's true, right? I mean, it's like driverless cars, right? You can't. You still have to have the driver at the wheel, because if the accident happens, you blame the driver. You don't blame the self-driving tool, isn't it? So yeah, at least for healthcare, at least we at the very last resort, right? There's still the doctor, my certificate and my face to say nice things to patients. So I think from that point of view, I won't be replaced yet, right? Is that right?
Can I just add on to the excitement, since it's healthcare and we ought to be aligned. So it's probably not happening today, but it's going to happen really soon in the future, that AI will enable us to provide personalized treatment, right? Today, if you're diagnosed with cancer, touch wood, you will be blasted with generic treatments like just radiotherapy, chemotherapy, but actually no one really knows whether it works. And oftentimes, many of us suffer from the bystander effects like losing your hair, feeling nauseous, and you don't even know whether you'll be treated. But if AI, as what Ngiam says, can help to see through all that information and to suggest the best treatment for each individual, then you will be taking therapeutics and drugs that's meant for you, or even we can reformulate or design a treatment package that is meant for you. For those of you who were here this morning with Minister Chan Choo Seng, Minister said that even for education, you can personalize it. You train based on the person's capability. So why not be able to do that for healthcare, right? Because you don't just take drugs just because you have a flu, you think that it is, take one of the antibiotics and it's fine, but perhaps it's not. Perhaps you have an autoimmune disease and we should be treating that instead. But today's information does not help the doctor to make those intelligent, informed decisions. So I imagine this will change for the better in future.
Yeah, absolutely. So I just want to bring out one question here that's relevant to what Pauline has just brought out. And the question states that healthcare generally needs evidence-based data to substantiate the treatment or services rendered. How and who to validate the resources gathered or curated by AI? So this is a question about how do we know that this AI is good enough? So maybe from Pauline, you can tell us how you evaluate whether AI is good enough.
Wow, I thought that's like your department.
Yeah.
I guess as I mentioned just now, right, it's how you train the AI, because, data in, data out, rubbish in, rubbish out. And I guess that's where Ngiam says he believes that doctors or clinical practitioners today will not be displaced because they are really, really important in training the AI to give, beneficial output to people. And of course, again, this morning, if you guys were here, I think the keynote speech, the professor from Stanford said it's not just about AI for good, right? It's really human-centric AI. And of course, we assume that humans want the best for themselves. And so they would train in healthcare the AI such that that's how they would make a diagnosis and a treatment recommendation. So they wouldn't, like clinical practitioners, I hope, will not be training AI to give you the wrong diagnosis, right? And there are also committees around the world being set up now to sort of govern that, whether or not the AI is considered good AI or bad AI. With many other areas of science, there are ethics committees and regulatory committees that are set up to help guide the development of technology. And I think for AI, definitely not different. Yeah.
Yeah, absolutely. So one of the biggest challenges we have is to balance creativity, as in innovation in AI, and also the regulatory aspects of AI. So maybe, Moni, you can share with us your experience in how do you navigate that balance between being able to innovate and push the boundaries of AI, and at the same time meeting ethical and accuracy standards.
So yeah, thanks for the question. So first of all, I would like to declare I'm a huge advocate for reliable use of AI, and also I agree that AI it's a fast advancing technology. Guilty as charged. Occasionally, we may not fully understand how everything works. That's true. Nevertheless, like Prof. Ngiam mentioned, we should have a balanced view. We shouldn't single out AI and hold AI to a unrealistic high standard of expectation, right? As a computer scientist, correct me if I'm wrong, the physician here, I think we should just evaluate AI as we evaluate any clinical experts. What it means is that assuming you hire someone for perform certain tasks within the healthcare sector, regardless it's operational or clinical, right? And then as a human, you will first probably check this personnel's track record, right? Does he has any relevant experience and how did he or she perform for this task previously? So same thing for AI, right? You should evaluate that AI using retrospective data for a particular task and how well and how reliable this AI for that particular task as a track record. Okay, if this product or this human personnel have a very promising track record, then usually we bring this person on board. Maybe we have a probation period, right, to try it out. Similar for AI, I think then we have a prospective trial as well that put the AI on the job. At the same time, we closely monitor their performance, right? So just saying for myself, right, human beings, we make mistakes as well, but then we have many risk control mechanisms already implemented within the hospital to actually de-risk from a lot of these factors. And same thing that we can play AI into these systems and exactly prospectively observe how it performs and what kind of risk it brings in, and then whether it the benefit brings in and the risk benefit, which one is bigger ones.
Yeah, and to answer one of the questions here, some challenges in healthcare industry in terms of sustainability and reducing things like regulations and things like that for the implementation of AI. I guarantee you, if you want to fall asleep, right, and it's a good time to fall asleep now, please go and read the hospital policies for deploying new tools, right? It's a 200-page document. It covers everything from implementation, cybersecurity, regulatory approval, third-party risk. Okay, guarantee put you to sleep. Okay, so I would say that from an AI innovator point of view, there are already a lot of regulations. There are already a lot of safeguards to ensure that these tools, when they are deployed, are indeed safe, are indeed tested, and therefore being able to perform as with any other medical device, right? So I just want to draw your attention to one fact, and relevant to one of the questions here, is that not all AI tools are regulated. Okay, so let's be extremely clear about that, right? So if you have a medical claim, you claim to diagnose or to treat anything, that's AI, right? A regulated AI tools, meaning you say that this AI can diagnose a heart attack, or this AI can treat something, that clearly is a regulated AI tool, right? Or what you call software as a medical device. The Health Sciences Authority, HSA, has very, very comprehensive documentation. Again, very good to put you to sleep, right? Please go and read it if you want to sleep. Whereas the other non-regulated devices, anything that improves hospital efficiency or administrative efficiency, that's not regulated, right? So there's where there's a gray zone. The gray zone is what if I have a chatbot that nudges you to better health? Is it a medical device? Some say yes, some say no, right? Because nudging is a form of giving you some kind of advice, but the patient can choose not to do it, right? So, again, then it's not the same as a doctor saying that you have to take this tablet or these medicines for you. That's not the same. Okay, so I think there's a clear line between regulated and unregulated devices, and I would want to swing towards the unregulated devices to get you guys excited, right? Because this is really where the opportunity is. So earlier, Pauline was telling me about Jarvis, right? Telling us about Jarvis. How we wish you had Jarvis. It's great, right? Every one of you will have one of them on the phone, manage your life all day long, right? And talk to you, even chat with you if you wanted. Okay, so that day has not arrived. So I would put it to everyone here in the room that if you come out with what we call, this is a agentic AI. Sorry to introduce a new term. It's called agentic AI. Basically, an agent that is able to perform somewhat autonomously a particular complex function, right? So take some examples, right? Organize a big birthday bash for XYZ with this team and do all that and organize everything. Find the best price. That's agentic, right? That's asking Jarvis to organize Tony Stark's birthday. Okay, yeah. So hasn't arrived yet. It will require probably 1 or 2 technical advances. We're that close. And certainly that is a great opportunity. So I'm going to put it to our guests here to ask them, what would you want from it?
From my Jarvis.
Yeah, from your Jarvis, yeah.
To do my work for me.
To do your work for you. Yeah.
We spend so much time looking at grant proposals, evaluating it. If you could just tell my Jarvis, that's the outcome we want to achieve, go find the great innovators and create those companies for me.
Exactly. How many of you have more than 300 emails in your inbox? Unread? Me. I want my Jarvis to read all my emails and reply them. Morning, what about you?
Okay, so where my educator head. I want Jarvis in general, right, to remove all the, as you guys say, all the boring and repetitive and sort of easy tasks from our life. Okay, it sounds a bit funny, and kind of push us to evolve again. Okay, I see human as a species, we are getting very comfortable with where we are now. So I think AI is a good challenge to us, right? Because AI comes in, it does show promising capability that kind of replace some of our roles in doing very simple tasks in our society. Okay, if you put it in a positive term, that will free us up to do something more creative and something more challenging. A more negative term is that it will force us to think of what better thing we can contribute to the world. Rather than doing something repetitive like going through our paperwork or going through unrelated emails and things like that. So I do see as same as the educator, right? It forces us to, because large language model can summarize, as I say, complex topics like AI and programmings, probably even in better ways than many of our instructors, including myself. So it forced educator for us to innovate again and think about what are the creative ways and interactive ways for teach our students, right? So I think that's what we wish Jarvis will push me to evolve myself. Yeah.
I wanted to ask, because you guys are experts, right? So AI was kind of, modeled after cats. And because cats, so you think you can train it, you think you can control the fella, but the fella will give you a response that you don't expect. Unlike dogs, right? So dogs is like machine learning. You train them and then you know what's the response going to be. But cats, so for example, if our Jarvis, we think that our Jarvis is going to, challenge you, they might challenge you to give you a response that you're not prepared for. So what would you do about that? Sorry to reverse.
Yeah, that's a very profound. Okay, but then you are indeed right. I mean, AI has surprised us for many occasions. For example, AlphaGo, right? I'm not sure you heard about the Move 37 story. When AlphaGo actually play a move in the Go, called the Move 37, is one move while he challenged the champion Lee from South Korea. It was one move that will never play by a human player, and everyone thought that was a mistake. But then only after when he won the game, people realized that's probably the most brilliant move in human history, at least in the last 10 years. So you're right, the AI sometimes may come up something that surprises us. How do we do that? I don't know, but I'm more positive guy. I see it as a positive push us to be better than what we are now. Yeah.
Yeah, I agree. So I have the real use cases in healthcare. So for example, we have a model that's running in production today at NUHS where it helps us predict the length of stay of our patients, right? So the patient comes in on day 1, the machine reads the text information and whatever lab information related to the patient, and it gives you a prediction on day 1 how long would the patient stay, right? So this is a real story. So I had a patient come in with a intestinal condition, which I fixed overnight. And next day I was just telling the patient, "Wow, you look okay. You can go back today, right? So it's no issue." And I went to click on this machine, right, and say, "Hey, what does the machine say?" The machine says 6 days. I was like, the machine must be wrong. This is a lousy machine. I'm going to call my data scientist and, "Hey, scold you. How come your machine is so off by so many days? Terrible." 9 o'clock, I got a phone call from my doctor and say, "Hey, your patient got a stroke." I was like, "What?" And immediately they jumped on him and they thrombolized, well, they dissolved the clot and things like that, put him in a neuro ICU. 5 days later, they called me and said, oh, can we send the patient home today? Then like, can you just keep the patient for one more day just to prove that it is wrong? Super annoying, right? It's super annoying when you find the machine is right and you're wrong, right? So again, on the topic of surprises, I think machines would, or AI tools such as these will start giving us some of these surprises. I think they are generally to be taken in positive light, meaning to say that if you use it, then it's great, right? You will help your patients, and I do use these tools routinely to help plan what I do for my patients. So that is a nice little story about AI. But going forwards, I think what it changes is, I just want to put this thought to everybody. For many generations, decades, people have been talking about the knowledge economy, correct? Everyone talks about the knowledge economy. You need to know more. And therefore, we make our kids, right, take PSLE, learn some more, do some more, cram them with knowledge, Yeah, well, that is over, okay? Because the interface between knowledge and being able to deliver it is getting smaller and smaller. Indeed, it will disappear, right? If you ask any kid today, right, hey, solve this PSLE question, they will take a picture and say, okay, solve, there. All right? So knowledge is no longer a commodity anymore. Knowledge is open to anyone, right? So what's the next bound? What's the next economy? Well, I put it to you, at least from the healthcare perspective, it's going to be the experience economy, right? Meaning, what is valuable is your experience, right? It's in how you take the insights given by the AI and interpret that for your use case. Right? Just because you can ask ChatGPT today, how do I set up a multi-billion-dollar company? It'll tell you. But really, if everybody just follows that, we're going to have multi-billionaires overnight, right? No, it's not going to happen, right? So you got to take that information. It's not wrong, right? And interpret that into something that you can now make into a company. So I think one of the things that Pauline can do is to make every company go through that question first. Have you asked ChatGPT? So do you think you can do that?
Yeah, it will be in my evaluation application form for grants. Ask your Jarvis first.
Yeah, so one of the interesting things, just to share again, just about a year and a half ago in the early part of 2023, that was just after ChatGPT was launched, right? Any new technology today, right, you think about, the general first reaction is, no, it must be bad, right? And so much bad news was coming out of it, and in January of 2023, that it was they thought that OpenAI is going to flop overnight, right? But something changed because it was so easy to use, right? And I saw my programmers struggling down there. It's still debugging code, right? I said, tell you what, why don't you just use GPT and try to debug this? And in 5 minutes, it was debugged. 5 minutes, okay? So from that point on, I said, okay, I'm going to pay for all of you. You're all going to have one account. Okay, I do not allow you to write notes by yourself anymore. Do not allow you to write minutes anymore. Please use ChatGPT, right? That is a 180-degree turn, right? From no bad technology to you must use it. So I'm just putting to you, and maybe you can, I'm going to ask my panelists, right? What do you think about with this technology? Do you now make everyone use it? Or do you just say that, at your discretion? Morning, what do you think?
Again, very profound question. Okay, so two layers. For my researchers, of course, they research in language models and inevitably large language model. Right? So I do encourage them to use it to understand how it works, understand its limitation, right? How it may hallucinate and how we can detect is hallucinating and how we can implement. Very funny enough, you build. At least our solution is that we build another AI to watch over another AI and to make sure the other AI is not BSing. Yeah, it's like you use magic to fight with magic, right? We hope that we do see some effects, but we hope that this won't form a loop that serves itself. So the fact check bit, the fact check AIs and the reliability and value layers of AI is one of the focus in my lab. Meaning that, as I mentioned, a bunch of our team are working on reinforcement learning. So they also use reinforcement learning to sort of teach the AI our values about the society, right? Let's say if some response from the AI is against human values, we give a penalty. And over time, at least AI pretend, right? They can pretend to start to adapt, to understand our value as well. So research-wise, this is all fully open. But educational-wise, I think Cho Chuan was here this morning, so I think we need to ask Cho Chuan how university going to see, because okay, it's by data, cite you the data, right? The good news is that it becomes a lot easier for a professor now to mark all the written assignments, because everything reads beautiful now. Everyone can write poems now, and also it's true data. Our colleague here can confirm. NUS, I think in the last 2 semesters, right, the gradings for most of the courses have been shifting all towards A, right? Because everyone just have very good
perfect
written reports. We can't stop there, right? Like I say, that kind of have to motivate. I mean, either force us or motivate us or incentivize us to evolve education, or how should I say, or push education to its right form, right? When our instructors can no longer be so lazy that we give one standard question and expect some report to do. Maybe now next time, I do foresee that we probably need to do, like my old days, we have one-to-one interviews with our lecturers, right? When during my old days, one of the courses is that the exam is that you go to the lecturer, you can just ask anything in the book, and to test you how well you understand. So maybe that's the right way for us to, trigger our critical thinkings and test, educate our next generation.
So I'm just going to ask Pauline this next question. So what is the role of teachers, given that students are able to turn in perfect assignments?
Actually, this morning I put in one of those questions to Minister. It just didn't get answered.
Okay, so maybe you want to have a stab at that?
Yeah, no, because in Singapore, actually our population is dwindling, right? So they are closing schools, which means, is there a point in time that because as AI and technology increases, could that function actually be served, or the basic fundamental function be served by AI? And then what additional role is required of human teachers, right? And I totally agree with you, right? It's the experience. I think, okay, I'm not sure because I'm quite a tech person, yeah. So I actually really embrace tech and how technology advancements will change lives and how humans and the ecosystem will evolve accordingly. So it might sound very bleak that someday in the future, actually our teachers are AI, right? But AI itself learned from people who are teachers. So it's a bit like a virtuous cycle. What is the role? Because teacher is just defined as someone who imparts knowledge and teaches someone else from experience. So that role doesn't change, whether you define that as a teacher in the school or a teacher at work or clinician teacher in the hospital. You're teaching someone and something. So I don't think that role would be completely displaced. It's just that it is evolved. And we have to just kind of get used to how life is defined in the future.
Yeah, exactly. So we see many parallels in healthcare, but I'll put it to you that for teaching, I think we still need teachers of the heart, right? AI cannot teach the heart, right? It's quite difficult, right? No, it's true. I mean, today you can try this out in ChatGPT, right? And you start a conversation in ChatGPT and you pretend, okay, you are a boyfriend and then there's girlfriend, right? Say, hey, I'm going out for drinks with my bros, right? And then the reply will be, so, oh, great, you're wonderful, you have a good time, right? But in real life, it's not like that, right? If I said that to my wife, right, she would say, okay, lor. And then say, are you sure you're okay? Yeah, no problem, you go. You see, that's something that an AI will never appreciate. The answer is, it's okay, you can go, right? The AI will take it, yeah, good, you can go. You see, nuanced human emotions of the heart are not something that AI can pick up easily. Maybe in the future, but then that's it, right? In its multiple permutations across cultures, across relationships, it's going to be hard, right? And EQ, right, is still going to be a very big part of human interactions going forward. So I want to just quickly mention this about teaching as well. So we come up with some AI bots that can teach our students, really. We are able to adapt to their learning needs, right? So meaning that if they can answer an easy question, we give them a harder one. If they answer the harder one, they even harder questions, right? And so on and so forth. And we can adapt the questions. The term we use is Socratic questioning, right? To the kind of content and the kind of learner. So that's already possible today, right? Meaning that adaptive learning is already possible today with certain AI tools, but nobody's going to be able, at least not yet, I think, to be able to teach hard to students, right? Think about motivation to learn. Think about aspiration. What career do you want to be? How do you make an AI teach that, right? Because it's so unique to the cultural and individual circumstances. So I put it to you that teachers still have a role. Oh, Feng. There's still a role for teachers.
When my wife say okay law to me, my legs start shaking.
Loaded answer.
Exactly, right? So I think that whilst we all think that, wow, AI is going to take over everything, I guarantee you, right, human-centric AI is the way that will happen. And really, I think if we are able to fit that gap between what is the promise of AI and what really works for humans, I think that's where we will find a real synergy. And I'm going to bring this back to healthcare, right? On every poll, at every single time we talk to our patients in terms of patient feedback, right? At no point of time did any patient say that, oh, I want to be treated by AI. Zero, not once. But comparing, we made a straw poll. I think, Pauline, you were on that little chat group as well. So the straw poll is very easy, okay? You have a doctor, very experienced, treating you. Or doctor with experience and using AI, or AI alone. So guess which one was the most favorite answer?
Doctor with AI, right?
Exactly. Almost every poll we do, right, 90% of respondents will say doctor with AI. Because we understand, right, doctors are busy people, right? And they want to, of course, help the patient, but of course, we don't have all the time to go and read everything, do everything, right? So that's where this augmentation comes in, right, with the AI to support us in what we do. And that's going to be true, not just for doctors, for nurses. I can share with you some of our initiatives on nursing robot companions that will help our nurses look after patients. But still, the patient wants to see the nurse, right? You don't call the robot, hey, you look after me, right? So I think that's still going to be the case, right? And I'm going to round up and ask our panelists here, right? How do you see the future? Let's say just take it a realistic, next 3 to 5 years. Where do you see AI going in the next 3 to 5 years?
So, okay, I see for healthcare, just for healthcare, right? Two sectors. For healthcare, as Prof. Ngiam already mentioned, for a lot of low-risk tasks, right, very administrative, operational tasks, I would say next 3 to 5 years, you will hardly see many human beings in those departments. For more higher risk, more clinically relevant tasks, based on the current development, medical imaging is moving the fastest, right? We already have many virtual solutions for various diseases. The problem is that it's too fragmented. The complaint by the doctors rightly that we have one AI tool for every single organs, and then basically, yeah, you're right. So if they want to see the entire human body, they need to install like 12, a dozen of tools. That doesn't make sense. So I think the next 3 to 5 years, a lot of consolidation will happen, and eventually, as we all will see, a foundational model that's going to understand every single modality of medical imaging, be it ultrasound, X-rays, CT, MRI. It can reach everything, right? That's one field. I think treatment will be challenging, but we'll be moving towards there. But then I will leave more space for healthcare for Prof. Ngiam to discuss. But my primary appointment with school of public health, right? I want to advocate the potential of AI being used for population health and public health as well. And because as you can see, a lot of those spaces are actually at lower risk. As Prof. Ngiam mentioned, for example, behavior nudging, right? AI being a body can share with you what are better tips to have a healthier lifestyle, healthier diet, suggest you what's a better way for you to exercise and stay active routines. And education, as I mentioned just now, we are living in an information overwhelmed society. How can we summarize and in this more interesting and interactive bite-sized information and educate our population better, either about infectious disease or their own health, etc. Of course, discriminative AI can be used to do screening, etc., to find out high-risk populations and take care of them. And then large language models can be a chatbot to deal with, not as therapy, but as probably the first respondent, or at least just a listener for mental folks with mental health issue. We are Singaporeans, right? We are very hardworking and very grassroots to begin with. So yes, occasionally it's good to have at least someone listen to you, right? So I do see that's going to happen in the next 3 to 5 years.
Great. Pauline.
Yeah, I think for me, because 3 to 5 years is pretty short. I mean, although pretty short because for technology advancement is very fast. I would say for healthcare, because as we mentioned, it's one of the slowest sector to adopt new technologies for the purpose of patient care. I think in the next 3 to 5 years, it's more of augmentation. Less so replacement, augmentation of still human practitioners, and also mainstreaming, right? Like how social media became part of our lifestyle. I think having AI to advise, predict, and assist clinical practice will become mainstream. So it becomes something that we all expect. Like if you didn't have that in your healthcare, something is missing, right? You need to feel like when you pick up your phone, you're close to a doctor or you're close to an AI advisor, and even things like our choice of how we want to be treated will all be augmented by AI and mainstreamed, I think, yeah.
Wow. Grand visions. I really look forward to that day when, today, when you wake up these days, you take it for granted that the internet is there, right? So very few of us can operate without the internet today. I feel anxious when I go to a foreign country, I don't have data connection, that kind of feeling, right? So how am I going to get a cab? How am I going to find my way around? It's like you're being emasculated. In the past, you go and buy a map, right? And then navigate through the city yourself, but no longer, right? So we're so dependent on technology today, and what Pauline and Morning are essentially saying that these will become weaved into the fabric of our lives going forwards. And for the people in the audience as well as others, it's hope that we can be part of that journey, right? Because that journey will lead us to great places, and if you don't participate, then you have to accept what's being there. And with that, I want to thank our panelists. Please give them a round of applause.
Thank you, panelists, for sharing valuable insights on how we can use AI as both partner and also augmentation to move towards more holistic and personalized care in Singapore. To our audience, thank you so much for your amazing participation, for taking time to join us today at NUS FutureWork 2.0. And thank you, and see you at our next event!